Hello, 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 everyone. Welcome, welcome, welcome. Tonight, we're going to talk about your kidneys and the heat. This past week in Northwest Indiana, temperatures have been in the high 80s to the upper 90s. Over the 4th of July holiday weekend here in Hammond, we're expecting temperatures in the 90s and possibly as high as 95. I've noticed in my building that when the temperature is high outside, I tend to have more difficulty breathing. I slow down in my movements, even when I'm in the air conditioned indoors. That made me wonder what effect, if any, does high temperatures and heat have on your kidney? How does extremely high temperature affect those of us with kidney disease or those of us on dialysis or maybe that have been transplanted? So I looked into it and I want to share my research with you and see what you think. So, high temperatures and heat waves can cause negative impact on your kidney health. High temperatures and heat waves can negatively impact kidney health, particularly leading to the potential for kidney damage, increased risk of kidney stones, urinary tract infections. Uh, the kidney is critical for filtering waste and regulating bodily fluids, can be particularly vulnerable in hot weather due to dehydration and other heat related factors. So far this summer, we have seen very high temperatures and humidity across the country. According to the National Kidney Foundation, heat wave illness could affect many kidney patients this summer. Problems with the heat are frequently seen when the body temperature is at or near 104 degrees Fahrenheit and where the humidity is over 70%. Once the humidity is high, sweating becomes less effective. It is hard to dissipate body heat and core temperatures when it rises to that point. Heat illness is characterized by a loss of sweating, confusion, leading to coma, fast pulse, low blood pressure, heart failure, and kidney failure. Patients with heat illness may not be able to notice the change, so others, like family and friends, must be alert when the temperature rises for the reaction of kidney patients. This is especially true of the very young and the very old, my hands up, very old, who are the most susceptible to heat related illness. Many psychiatric drugs predispose patients to heat illness. Obesity and alcohol abuse are very frequent risk factors for heat illness. If you already have kidney disease or on dialysis or had a kidney transplant, extreme heat can exacerbate or make those symptoms worse by hindering the body's ability to filter waste and excess fluid from the blood. So, what happens to your kidneys when someone has heat illness? When the body temperature exceeds 104 degrees, this causes significant problems for the kidneys. Dehydration can cause low blood pressure and decreases in kidney function. Many metabolic systems, and these are the things that encompass all the chemical reactions in our body that convert food into energy and building blocks for growth and repair, these things may shut down in response to heat illness, leading to a further decline in kidney function. There is also a breakdown of muscle material that can result in kidney failure. And finally, heart failure and shock can also lead to kidney failure during episodes of heat stroke. So, what are the specific effects that we're talking about? First, a reduction in blood distributed to the kidneys, possibly resulting in acute kidney injury. Secondly, kidney stones by concentrating calcium and uric acid and creating too many urinary pathogens. Three, the likelihood that if a urinary tract infection could occur. And finally, heat stroke leading to kidney failure. So let's take a detailed look at this. First, dehydration. Sweating excessively in hot weather can lead to dehydration, which in turn reduces blood flow to the kidneys. This causes inflammation and potentially leads to kidney damage or kidney failure. Dehydration can occur if your body is sweating out lots of fluid faster than you're replacing it. When your body is dehydrated, your blood pressure begins to drop due to a decrease in blood volume. Maintaining a normal blood volume is essential for your organs to receive the oxygen and nutrients they need to function. So, what kind of symptoms should we be looking out for? Fatigue, thirst, dry mouth, dark colored urine and or urinating less frequently, dizziness, confusion, slurred speech. When the organs aren't getting enough blood, metabolic systems can begin to shut down. This includes the kidneys. The body begins to break down muscle tissue and divert blood flow from the kidneys during heat illness, which can result in renal failure. Next, reduced blood flow. As the body tries to cool itself by directing more blood to the skin, the kidneys can receive less blood flow, depriving them of oxygen and nutrients. Electrolyte imbalances. Excessive sweating can lead to electrolyte imbalances, which can further stress the kidneys. Next, there is an increased risk of kidney stones. Dehydration and changes in urine concentration can increase the risk of developing kidney stones. There's also an increased risk of urinary tract infection or UTIs. Heat tends to slow urinary production and hinders the removal of pathogens and increases the likelihood of urinary tract infections. Acute kidney injury. Studies show that extreme heat exposure is associated with a higher risk of AKI, particularly as temperature rises. A little discussion now about older adults like your Uncle Jim. Older adults in particular are more susceptible to heat-related illnesses and kidney problems because their bodies may not regulate temperatures as effectively. Elderly patients frequently have both kidney disease and heart disease and take medications that can lead to dehydration, like NSAIDs, for example. I'm going to talk about that in a minute. If they also have muscular, neurologic, or psychological diseases, psychiatric diseases, the medications that they take often predispose themselves to heat illness. People with chronic kidney disease, folks with pre-existing conditions like chronic kidney disease, are at a higher risk of complications from heat stress and dehydration. Individuals on certain medications. Some medications can affect kidney function and increase the risk of dehydration, making individuals more vulnerable to heat-related kidney issues. These medicines include non-steroidal anti-inflammatory drugs or NSAIDs like Motrin, ibuprofen, Advil, or Aleve. Use these products during extreme heat exposure, or use of these products during extreme heat exposure can lead to acute kidney failure. Other medications that can put you at risk for heat strokes. Diuretics. Diuretics work by removing excess sodium and water from the body through urine. They're often prescribed for high blood pressure, congestive heart failure, or edema. But the same mechanisms that make them helpful for these conditions can also make you dehydrated. This in turn affects the body's ability to regulate its temperature. Sweat is a protective mechanism to cool your body temperature when we get hot. And if we get dehydrated, it impairs our ability to cool ourselves. Secondly, calcium channel or beta blockers. For those with cardiovascular conditions or high blood pressure, problems with your heart, you may be prescribed a calcium channel or a beta blocker. These medications work to take the stress off the heart and can also relax blood vessels, lowering blood pressure. But they can also decrease your sense of thirst, which puts you at risk of dehydration when the heat increases and your need for fluid increases. Selective serotonin receptor inhibitors, or SSRIs, People with anxiety or depression are often prescribed selective serotonin receptor inhibitors like Prozac or Zoloft to help ease the symptoms, but SSRIs can affect the body's ability to regulate its temperature. The result can be too much sweating or, in some cases, not enough, which can pose a serious danger in hot weather. ADHD medications. Attention deficit disorder is often treated with stimulant or amphetamine-based medications like Ritalin or Adderall, but these medications also increase metabolism and heart rate, which in turn increases body heat, putting you at risk for heat complications. Thyroid replacement medications. If your thyroid gland isn't producing enough hormones, you may take a medication that replaces them, like Synthyroid. Since these medications increase your metabolic rate, it also makes you more sensitive to heat, especially when you're just starting out or adjusting your dosage. And finally, antihistamines. Antihistamines are used for everything from allergies to sleeping to travel sickness, but they also affect neurotransmitters that regulate body functions like sweating. This can make it harder for your body to cool itself on hot days. So let's talk about people on dialysis for a minute. Extreme heat can pose significant risks for people on dialysis, increasing their risk of death, particularly during heat waves with high humidity. Dialysis patients are more vulnerable to heat-related illness due to factors like dehydration, decreased kidney function, and potential cardiovascular issues. Let's take a more detailed look. There is an increased risk of death. Studies show a notable increase of mortality rates among dialysis patients during heat waves, especially those living in humid southeastern states, according to the University of Wisconsin School of Medicine and Public Health. A study published in the American Journal of Kidney Disease found that patients on dialysis are more likely to die during humid heat events defined by a heat index exceeding 105 degrees Fahrenheit for 2 or more days, or 115 degrees for 1 day. This increased risk is attributed to the body's ability to regulate temperature effectively during extreme heat, especially when combined with psychological stresses of dialysis. Physiological effects of heat, the dehydration again. Dialysis patients often have fluid restrictions, and extreme heat can exacerbate dehydration, leading to low blood pressure and further strain the kidneys, according to the Cincinnati Dialysis Home blog. And by the way, as always, all of my research is pinned to the top of my Facebook page. In the comments, all the articles that I'm mentioning, you can find there. And if you want to drill down a little bit on this issue about heat and kidney disease, there's all kinds of interesting things there for you to look at. Kidney function. Heat can lead to decreased kidney function and acute kidney injury. Cardiovascular issues. The heart has to work harder to pump blood to the skin to cool the body down during heat stress, particularly leading to heart failure, particularly in patients with pre-existing heart conditions. A heat stroke. In severe cases, extreme heat can cause heat stroke, which can be deadly if not treated promptly. The impact of climate change. Climate change is predicted to bring more frequent and intense heat waves, further increasing the risk for dialysis patients. Disruptions from flooding or power outages. During extreme weather events, this can also interrupt dialysis treatments and increase the risk of adverse health outcomes. So what are the recommendations for dialysis patients to stay healthy during extreme heat? First, stay hydrated. Drink the recommended amount of fluids. Avoid caffeine, salt, and alcohol. Stay cool. Avoid direct sunlight exposure, especially during the hottest hours of the day, and seek cool environments. Wear cool clothing. Opt for loose-fitting, lightly colored clothing. Monitor your symptoms. Be aware of signs of heat illness such as dizziness, headache, nausea, muscle cramps, and seek medical attention immediately when they start to occur. Follow medical advice. Adhere to your doctor's recommendations regarding fluid intake, medication, and dialysis treatment schedule. Okay, what about people that have kidney transplants? Extreme heat can pose significant risks to kidney transplant recipients, potentially leading to kidney function decline, graft failure, and even death. Studies have shown a correlation between higher temperatures and increased risk of minor adverse kidney events in transplant patients. Staying hydrated, avoiding prolonged sun exposure, and recognizing signs of heat illness for this vulnerable population during hot weather is mission critical. So let's take a look at this in a little more detail. Increased risk of adverse kidney events. Research indicates that kidney transplant recipients are exposed to higher daily temperatures, particularly those above 86 degrees Fahrenheit. Now notice that's like 20 degrees lower than the dialysis level at 104. At this level, transplant patients can experience a higher risk of major adverse kidney events, including graft failure or death. Kidney function decline. Higher temperatures have been linked to a decline in kidney function among transplant patients, even those with relatively stable kidney function. Geographic variability. Studies have shown that geographic variability increase these risks. In some regions experiencing a greater impact of heat on kidney health. The importance of hydration and sun protection. Maintaining adequate hydration and avoiding prolonged sun exposure are vital for kidney transplant recipients in hot weather. Dehydration can exacerbate kidney problems, and sun exposure can lead to skin cancer, a concern for those on immunosuppressants. Recognizing heat illness. It is critical for transplant patients and their caregivers to be aware of the signs and symptoms of heat-related illness. Things like fever, headache, dizziness, nausea require prompt medical attention if these symptoms are present. Access to cooling resources. Ensuring access to air conditioning and other cooling resources is essential for vulnerable transplant individuals during heat waves. Public health considerations. Public health initiatives and healthcare providers need to address the challenges posed by extreme heat for kidney transplant recipients, including providing education and access to resources and developing strategies for managing heat-related risks. So if the weather's hot and it's above 86, you want to avoid going outside. You want to stay in air-conditioned or cooled areas. So precautions. What can you do to protect yourself? What can you do to help yourself in the event of high temperatures? If you know someone with the risk factors we've discussed so far for heat illness, special precautions must be taken, even if it's yourself. Check on that elderly kidney patient frequently and make sure they have access to a cooling environment. The NKF recommends a mist bottle and a cooling fan to help out. For older patients, they should avoid diuretics and alcohol. Take them to cooling shelters if needed. For you as an individual, stay hydrated. Drink plenty of fluids, especially water throughout the day. Uncle Jim drinking plenty of fluid. Seek cool environments. Limit your exposure to extreme heat and spend time in air conditioning whenever possible. Dress appropriately. Wear light-colored, loose-fitting clothing that helps your body stay cool. Be mindful of medications. Talk to your doctor or pharmacist about medicines that could affect your kidney function or hydration. Pay attention to warning signs. Be aware of symptoms like dizziness, nausea, muscle cramps, which could indicate heat-related illness. Limit your physical activity during peak heat times. Avoid strenuous activity during the hottest parts of the day. So, what do you do if you suspect heat illness? So how do you protect yourself? What do you do if you suspect problems with the heat? If you have someone you think might be susceptible to heat illness, including yourself, if you're warm, confused, that other person is delirious, not making urine, breathing rapidly, you must get that person to a cooler environment. You should contact emergency services and have them transplanted to an emergency facility. If you have access to a fan, ice, or cooling mist, cool that patient off. If they are unconscious or responding poorly, do not offer liquids. Do not offer liquids to an unconscious or poorly responding person because they may aspirate or it could lead to pneumonia, gook in your lungs. What can you do? What you can do is to apply external cooling like mist plus fan, ice packs to the head and neck, remove clothing and apply cold compresses. An ice bath might be called for in extreme circumstances. The most important thing is to get the patient to emergency services. Also, it's very important to protect the patient's airway. So, in summary, stay in air-conditioned spaces. If you're spending time outdoors, do so early in the morning or the evening when conditions are less intensive. Bring water with you if you're outside. Replenish your body with hydrating fluids and foods. Stay hydrated. Wear loose-fitting clothing in lightweight fabrics. Protect your skin by applying sunscreen and wearing a hat or sunglasses if you go outside. Never leave humans or pets in a closed car in a hot environment. Use external cooling techniques like a mist fan or wet towel around your neck. Keep blinds and curtains closed to reduce indoor heat. Avoid alcoholic beverages because they can speed up dehydration. Avoid spicy food. Eat light. Avoid sugary foods. Check in regularly with those at risk of developing heat illness. If you suspect that someone has heat illness, get them to a cool location immediately. Call 911. Heat illness can be life-threatening, emergency, so it's important to act quickly. Signs of heat stroke include cramping, fatigue, abdominal pain, vomiting, lightheadedness, loss of sweating, headache, clammy skin, confusion. To help, get out of the sun, apply ice, call a doctor, or go to the emergency room. Take steps to protect yourself and others and enjoy your summer. That's our broadcast for this evening. I hope the advice was helpful. Our next broadcast is July 11th. Dr. Weems is going to be on with us. He's a pioneering PKD researcher. Should be a very, very interesting broadcast. I thank you for tuning in. Please like and share the broadcast, pass it around. As you know, the broadcast appears on Facebook. It also appears on my YouTube page. And I'll be posting the replay all week. So you should be able to find it if you're interested. So this is your Uncle Jim. I appreciate you tuning in. You have a good week. I will talk to you very soon. Take care and, stay out of the heat, man.